Basal cell carcinoma. The pathophysiology of basal cell carcinoma. BCC is the most common skin cancer in the US, making up over 90% of cases. And although it rarely spreads to distant areas, it can grow deeply and damage surrounding tissues. UV radiation, both from the sun and artificial sources like tanning beds, is a major cause, with fair skin and sun exposure increasing risks though some cases occur in non-exposed areas, such as the back of the scalp. It develops when skin cells, specifically basal cells, undergo genetic mutations due to prolonged exposure to UV radiation, causing uncontrolled growth. Instead of dying off like normal cells, these mutated cells keep multiplying, forming a slow-growing tumor that can invade nearby tissues but rarely spreads to other parts of the body.
Recognizing basal cell carcinoma and the key clinical manifestations. Basal cell carcinoma presents with a distinct clinical manifestation, primarily affecting sun-exposed areas of the skin. It often appears as a pearly white or translucent nodule with a smooth, shiny surface. Blood vessels running across the lesion. Slow-growing but invasive in nature, taking months or years to expand deeper into the tissue. Ulcerating or encrusting, where the center may break down into sores that doesn't heal. A firm scar-like plaque, sometimes resembling a flat fibrous area rather than a bump. And then color variations ranging from reddish or pearly to pigmented lesions in some cases.
All right, basal cell carcinoma, who is most at risk? So this is going to be anyone who is in UV light for a prolonged time, like the sun, tanning beds, or any UV lamps. The general risk factors are going to be anyone with fair skin, freckles, someone who's easily able to get sunburnt, someone with blonde, red hair, blue or green eyes will be most able to get skin damage. Specific risk factors are unusual or numerous moles, fair skin, and being prone to burns, any family history of basal cell carcinoma, frequent UV exposure, and any history for severe sunburns, especially in childhood.
Beyond the skin, the impact of basal cell carcinoma on organ function. Basal cell carcinoma primarily affects the skin but can progressively invade deeper layers, potentially harming surrounding tissues like muscles and nerves. While it rarely spreads to distant organs, untreated cases can lead to significant local damage, especially in sensitive areas like the face, impacting function. Prolonged exposure to UV radiation is a major contributor, triggering genetic mutations in basal cells that drive uncontrolled growth.
All right, key components of basal cell carcinoma. So first is going to be needing to inspect the skin, checking for any pearly lesions, ulcerations, or any abnormal pigmentation of the skin, and assessing for any wounds on the skin as well. So you're looking for any signs of infection, redness around the area, or any bleeding from the area. And you want to look at the face and neck the most because this is where the most sun exposure happens. So looking at this skin as well for the same symptoms of pearly lesions, ulcerations, any redness in this high risk area.
Sun safety and skin defense, reducing basal cell carcinoma risks. One is to avoid peak sun hours, usually about 10 a.m. to 4 a.m. or 4 p.m. You can also wear protective clothing like long sleeves, hats, and sunglasses to protect your skin. Use sunscreen, but you want to use at least SPF 30 or better. And you got to reapply often, especially if you go swimming or get it wet. Skip tanning beds. The high UV from tanning beds is a high risk. Stay in the shade when you're outdoors. Check your skin regularly for any changes, and get annual dermatology exams for early detection.
All right, diagnosis to recovery if you have basal cell carcinoma. Starting with the treatment, this is going to be removal of the tumor. So you'll want to go to your dermatologist, and if they suspect that it needs to be removed, they will do so. And this will prevent reoccurrence, and the function of the skin will restore and regrow. Therapy considerations, this depends on the patient, their age, health, and what the tumor looks like. This would be the size, the location, and the type of cells. Surgical options include MMS, extraction, and EDC are common procedures for removal. MOHS, micrographic surgery, also known as MMS, is best for high risk or reoccurrent cases where the basal cell carcinoma is reoccurring. And alternative treatments include radiation, photodynamic therapy, chirotherapy, and topical medications. The chirosurgery is using liquid nitrogen to destroy the low-risk tumor.
Confirming basal cell carcinoma, the role of biopsy. A biopsy is an important for all suspected BCC cases to verify the diagnosis and identify histological subtype. A biopsy is a procedure where a small sample of the skin tissue is removed and examined under a microscope to check for cancer cells. Doctors usually take this sample using a small cutting tool or a needle, and the process is quick, often done with local anesthesia to minimize discomfort for the patient.
And these are the references we used.
Welcome to Concordia News. Today we're discussing basal cell carcinoma, the most common type of skin cancer. What causes it? How can you recognize symptoms? And what should you do if you're diagnosed? To help us understand, we're joined by Dr. Madison, a leading dermatologist, and Nathan, who has firsthand experience with this condition. Dr. Madison, let's start with the basics. What exactly is basal cell carcinoma?
Yeah, good question. Basal cell carcinoma, also known as BCC, is a type of skin cancer that originates in the basal cell, which is responsible for producing new skin cells. It's primarily caused by long-term exposure to UV rays, ultraviolet radiation, either from the sun or tanning beds. While it's rarely life-threatening, it can cause significant damage if left untreated.
That's concerning. What are the symptoms that people should watch for?
Yeah, basal cell carcinoma can appear in different ways. Some common signs include a shiny skin-colored bump that may look pearly white or pink, a flat scaly patch that slowly enlarges over time, a brown waxy or blue lesion with slightly raised borders, a white waxy scar-like area that lacks a clear border. If you notice any of these, it's important to see your dermatologist to get evaluated.
That's great news. Now let's hear from someone who has experienced this firsthand. Nathan, thank you for joining us. Can you tell us about your journey with basal cell carcinoma?
Thanks for having me. Honestly, I didn't think about it much at first. I had this small pinkish bump on my cheek that wouldn't go away. It wasn't painful, but it would sometimes bleed, and I assumed it was just a stubborn pimple. Eventually, my wife convinced me to get checked, and that's when I was diagnosed with basal cell carcinoma.
That must have been a shock. What happened next?
Dr. Madison explained my options. Since my lesion was small, I underwent Mohs surgery, where they removed the cancer layers layer by layer while checking for remaining cancer cells. It was a bit nerve-wracking, but the procedure was precise, and I was relieved to know that they got everything.
Dr. Madison, what are the treatment options for basal cell carcinoma?
Yeah, good question. Treatment depends on the size, location, and condition of the tumor. The options include surgical excision. This is removing the tumor entirely. MOHS surgery, a specialized technique that ensures complete removal while preserving any healthy tissue in the area. Chirotherapy, this includes freezing the cancer cells using liquid nitrogen. Topical treatment, such as imiquimod or fluorosoril, which stimulates the immune system to fight off that basal cell carcinoma.
That's reassuring. Nathan, any advice for your viewers today?
Absolutely. Don't ignore changes in your skin. If something looks unusual or doesn't heal, get it checked and wear sunscreen. I wish I would have been more careful about about sun exposure.
Wise words. Dr. Madison, any final thoughts today?
Yeah, overall, prevention is key. Everyone should use sunscreen, wear protective clothing, and avoid excessive sun exposure if at all possible. Early detection makes a huge difference, so regularly look at your skin and check over your skin. That's essential.
Thank you both for sharing your insights. Next, we're going to take a look at a mother of 3 in Northern California who spends a lot of time playing outside with her kids. Although she thoroughly applies sunscreen to her children, she often forgot to apply sunscreen to herself. Let's take a look at the story of Suzanne and how her husband spotted something that may have saved her life.
Last summer, I spent a lot of time outside with my kids because I didn't know how else to entertain 3 toddlers. I also made sure to put protective clothing on them and reapply sunscreen and keep them hydrated. But when it came to myself, I thought I could just get a good tanning protection with SPF 10 and use the tanning oil.
My wife stays home with the kids most of the time while I work my 9-to-5 job at the post office. I always make sure and wear sunscreen on my face and put a hat to protect my scalp and face from the sun. Living in California, I've grown up doing this and never thought twice to check in with Susan to see if she protects her skin from the sun. I've noticed she has a freckle or mole on the top of her left shoulder, but I haven't thought anything of it. You know, everyone has moles and freckles. A couple months later, in mid-August, we were at the dinner table, and I noticed this mole that looked larger and had some different colors on it now, like a light tan and reddish color with no solid edges. When I pointed this out to her, she said she had never noticed.
Let's see what happens next with this heartwarming story.
I looked in the mirror and I was shocked that I had never spotted this before. I'm usually pretty good at being aware of my skin and checking for anything abnormal on my skin, like my doctor told me. Living in California, it's pretty normal for doctors to let us know to check for any abnormalities since it's so sunny here. This is how I know to be so careful with our little ones, but this type of situation isn't one you'd think would happen to yourself.
Susan was able to go to the dermatologist and they decided to do a skin biopsy of her mole, reviewing it from her skin. They also did a routine skin assessment to ensure no other abnormalities. After 2 weeks, Susan got the call that the biopsy resulted and was positive for basal cell carcinoma. This is your sign for all our viewers to please go get your skin checked. Mostly take the opportunity to use proper sun care such as sunscreen. Thank you for watching, and that's it for tonight on Concordia News.